Have you ever stopped to think about how life changes when someone is diagnosed with chronic kidney disease? It is not just the body that bears the burden. The mind and the emotions that you go through also have their own challenges. Many chronic kidney disease patients describe feeling like their world has turned upside down, with fear, frustration, and sadness becoming unexpected companions. Today, we're going to discuss the causes, share the tips on how to deal with the emotions associated with CKD, find ways to turn these challenges into strength, and also to make sure to understand that these conditions are not to be taken as your sole burden, but for something to be shared with people that love and care for you. So, what is chronic kidney disease? In the large scale of things, chronic kidney disease is a significant health issue with major risk factors, which include things like diabetes, hypertension, and high cholesterol. These also increase the risk of cardiovascular problems. CKD itself can damage endothelial cells, leading to complications in other organs. Recent studies are exploring the relationship between your kidney health and other organs, such as the lungs, your heart, your gut, the brain, and the immune system. Our body is a fine, well-oiled machine that maintains the balance called homeostasis. This happens through the communication between the kidneys and the brain. So, for instance, when the kidney or when the body itself detects fluid balance changes, special brain sensors react. E.g., if there's too much salt in the blood, the brain releases a hormone called vasopressin. This helps the kidney to absorb more water, keeping us hydrated. However, when the kidneys are not working well, such as in chronic kidney disease or even in acute kidney injury, they can negatively impact the brain's and the nervous system's response to any issues that are encountered. Research has shown that people with kidney dysfunction often experience neurological complications, including peripheral neuropathy. That is, the end of your hands and legs don't start to get feelings. You also have things like muscle weakness or even sensory issues like altered smell, altered vision, altered hearing, not being able to listen well, not being able to see well. So moreover, these cognitive problems in CKD can range from mild confusion to severe conditions like dementia, where you are unable to remember things, and that will affect your daily activities. So patients with CKD are very likely or more likely to suffer from depression compared to those with normal kidney function. So there's an increased challenge of having deep emotional reactions like depression, dementia, and cognitive decline among people living with CKD. Living with CKD often requires you to have significant lifestyle adjustments, such as adapting to strict dietary restrictions, frequent medical appointments, and the looming uncertainty of disease progression. This can take a toll on your mental health, leading to feelings of isolation, depression, or even anxiety about the future. Some patients wrestle with questions like, why me? How do I keep going? Is it normal for me to feel this way? Finding ways above these emotional hurdles is very important. So how can someone with CKD stay emotionally resilient? Let's talk about strategies that can help a patient with CKD. First, you have to acknowledge your feelings. Suppressing emotions often does more harm than good. It's okay to feel overwhelmed or upset. Acknowledge these emotions without judgment. Journaling or speaking to a trusted friend or family member can provide an outlet for these feelings. That leads us to the second point. Seek support. Connect with people that understand your journey. That will make a very large difference in how you feel. Support groups for CKD patients exist, whether in person or online. They can offer a sense of community and shared understanding. Sometimes just hearing someone say, I've been there too, can lighten your emotional load. Third, educate yourself. Knowledge is power. It's a powerful tool against fear. Learn about your condition to the letter, the treatment options, the lifestyle adjustments. Be very thorough with everything you research. Understand what's happening and why. It becomes very easy to make informed decisions and feel more in control when you have much more knowledge of the condition that you are battling. 4. Focus on what you can control. It is easy to dwell on things that you can't change, but shifting your attention to what can I control is empowering. Whether it is sticking to your prescribed diet, attending follow-up appointments, or engaging in light exercises, these small actions can make a big difference. Number 5, adopt a positive routine. Incorporate activities that bring you joy and relaxation in your daily life. You can try meditation. You can try getting new hobbies like reading, enjoying art, drawing, or even gardening can be therapeutic. Have a routine that includes moments of happiness. You can even go out with your family. They will improve your overall outlook. 6. Professional help is okay. If the emotional burden feels too heavy, seeking professional help is a sign of strength, not weakness. Therapists and counselors trained in chronic illness management can provide strategies to cope with the psychological aspects of managing CKD. Remember, CKD is a part of your life, but it's not your whole identity. With the right mindset and support, many patients find ways to adapt and thrive despite the challenges. Every small step you take towards your emotional well-being is a victory worth celebrating. And as you navigate this journey, keep reminding yourself, you are stronger than you think. And we have come to the end of another episode of Circle Direct Podcast. I remain your host, Dr. Tiwa. Until next time, please make sure to leave comments and share this video so that everyone can also be as informed as you are in our quest to make sure everyone has a proactive lifestyle to their own personal health. Thank you very much and see you once again. Bye.